I just wanted to clarify on the vaccine that you mentioned to Christian's question. So this is a different vaccine than what the children had before. Is that correct for the vaccine-derived polio virus? Just so that I'm clear on that. And one last question, which would be if you're hoping or expecting that that the success of this rollout this time will perhaps lead to better humanitarian cooperation on other issues. Thank you.
Rik, if you don't answers, because now that I said it was the last one, of course, I have two more hands, but we really need to go to the next subject. So please, if you can answer shortly, thank you.
Okay. So, all very good questions. So, first of all, yes, of course, we definitely expect other challenges. Every day is different. There's always hurdles, etc. The southern zone is a larger area. And we also know that there's some kids, larger group of population outside that zone, which we have to reach. So we are discussing and negotiating on that. But it's also a larger area, and we are with the same 513 teams, etc. So we're difficult. Also, the north population more spread out, etc. There will be also different challenges on this virus. It's a novel oral polio vaccine, NOPV2, and it's a polio vaccine was being used to stop the transmission of this variant polio virus type 2, this so-called CVDPV2, currently the most prevalent form of the variant polio virus. And I just want to say it's an absolutely safe and effective, offers protections against paralysis, and it's been globally recommended for this variant type 2. And this type was found in the recent samples from Gaza. And since the rollout of this NOPV type, again in March 2021, more than 1.2 billion doses of this vaccine have been used to protect children of 40 countries all over against this type 2 variant polio virus. Your last points. Do I think this will have an impact on other humanitarian activities? I would hope so. I think it should. And I think that all parties, conflict, but also member states, we should really push for that. If this is possible, in a way, we should do much better in what I call the routine, what should be by now a routine humanitarian operation, because we have massive challenges, as I described, in health, but also in the whole wash area, the water and sanitation area, the food security, and specifically shelter. So much more is needed. So I would expect that this will maybe give another spirit and a different approach. So yes.
Thank you very much. Brief, please, Jamie. Associated Press.
Thank you, Dr. Peeperkorn. This is Jamie Keaton from Associated Press. Just to make sure I'm getting my maths correct, you essentially said over 161,000 kids have been vaccinated in the first 2 days. The total is your total goal is 640,000. So that basically comes to more than a quarter of all kids that you want to reach. I just want to make sure that's correct. And then the second thing is I'd just like to follow up on Emma's question about Israel's motivations here, because you talked sort of in general terms about the desire to avoid international spread and how polio should not be affecting any kids these days. But can you just give us some insight into what actually tipped the balance for Israel specifically in terms of allowing this to go through, given all the other complexities in Gaza? Thank you.
Yeah, the first question, that's correct. So 640,000 children in total, and yeah, we reach now the total of 161,030 children. Again, so probably we underestimated the population in what we call the central zone, and maybe we overestimate a little in the southern zone, which is more, but we will see, and then go to the north. So that's correct. Yeah, I find it difficult. Your second point, like why and how, etc. For me, I think maybe the reason is that first of all, we talk about polio. And yes, it is. We talk about this global program. The world's on its track to eradication, and then suddenly you get polio in such an area. and the risk of polio within Gaza, but also the risk on international spread. I think that definitely helps. It's a factor, and maybe it's because we talk about children. I don't know. I don't even want to go there. I would not hope so. I would hope that this is something that the parties rally around, like, hey, this is important and this can be done. But again, we are not here just for polio. We focus now on polio, but specifically as WHO, we're looking at the broader health sector. And I described to you the enormous needs and enormous needs also, and what I still don't understand, why some basic humanitarian operations, and having been now 5-6 times, a long time, having been on many of these missions, why this is still not working properly, why we still have a problem with getting the amount of goods in a regular way, in Gaza, but also then getting these goods within Gaza, all over Gaza. And it is not only applicable, of course, for health, very much for all the other areas I mentioned, the wash, the shelter, but all still areas of fuel, the problems we have with cash, the problems we have to work properly as humanitarian agencies, etc. And we don't even talk about the recovery. So I think a lot needs to be changed and done. And the final, I think I think we sound like a broken record. I think to make a real movement, a real progress on all of that, you need, of course, a ceasefire, and you need to have a start in proper peace process and moving forward, that we can do this also in a different way. In the meantime, I think a lot can happen to improve humanitarian operations overall.
Yes, indeed. Lisa, really 1 minute, please. I really need to go ahead with the other briefings, just very quickly.
Yeah, Alessandra, not guilty. Okay, I have 2 questions, one for Rik and one for James Elder. UNICEF, who is also a participant, that is the organization in this process. So I'll quickly ask my questions. For you first, Rik, are you concerned that you had mentioned there were 3 suspected cases of polio and 1 child who actually had polio. Are you concerned that there may be many more undetected cases of polio? And if that's the case, does this create more problems for you and for the future of this disease in the West, in Gaza? And James, if you can hear me, please, good morning to you. I'd like essentially to get your impressions, your perspective about how the campaign has been going, and what concerns you may have that have so far gone unrecognized or undealt with. Thank you.
Thank you, Rik.
Yeah. So thanks for the question. Yeah, we are of course concerned, and that's why we also have together with Ministry of Health and partners, WHO is strengthening the surveillance system, and we have to go all out of that. And sometimes you hear stories now, there were some suspected cases of acute flaccid paralysis that can also be, of course, caused by other diseases and other causes than polio. But of course, we need to follow up and check. I mean, unfortunately, the environment, and I described that already, the incredibly poor water and sanitation, it's a lot of oral fecal transmission, massive amount of viral diseases. It's a breeding ground for all those diseases, including polio. So that's one. Secondly, I still want to mention that, because we go out all the time. And I said that from the beginning, this is in partnership. This is the Ministry of Health, WHO, UNICEF, and RAN. But I also want to say there's many NGOs, the international NGOs and national NGOs. And of course, most credit should go to those 2,200 health workers and community workers. Go out every day. The spirit is very high. And I want to again say, Gaza always had a very good vaccine acceptance rate. Parents know in Gaza, also in the West Bank, why they want to send their kids for vaccination. So people are very open. And even now, it's difficult to explain. It will be difficult to explain, and that will be a problem. why there's a second round needed, etc., and that people will have to continue with their routine immunizations. So together with UNICEF and partners in the ministry, we're looking already also now how to strengthen routine immunization. And the last quarter, we got almost 80-90% coverage on routine immunization. We have to update our specifically and do a better analysis on the denominator, but all of that has to be ongoing. And of course, finally, we have to start improving primary healthcare and all the other components. I didn't even discuss mental health and psychosocial supports for all, especially children and special needs groups, but actually for all Gazans. Over to you.
James, I think you are there. Can you briefly answer Lisa's, please?
Yeah, hi Lisa. Thanks very much. No, there's nothing to add at all. I think Rik captures that very well, both being on the ground and subject matter expert and so on. I guess in terms of broader concerns, it's as Rik was alluding to at the end of his answer just then, that this entire horror show for children is being normalized. And every day that I speak to people on the ground, no one really goes out and about without getting some kind of skin disease or some kind of infectious disease. And those things aren't being talked about. We'll seek to brief on that on Friday, Lisa. But essentially, if you look back to the briefings done by WHO and UNICEF as far back as late October, early November, all the warnings were made for some type of disease outbreak. We're seeing those. So the point is that warnings keep being ignored, and we are now seeing a normalization. It's good that a normalization of these horrors upon children. Basically, once these children have been vaccinated, they will go back to areas that in the coming week we imagine will be bombed again. There is nothing in that should be accepted as normal. And I think that everyone now accepts that the talks on ceasefires are just talks. For us to continually think that there's hope there after 10 months, we might be being a little bit naive. So something has to give, and that again has to fall on those leaders needing to represent their people. Over.
James, thank you very much. And thanks to Dr. Rik Peeperkorn for the extensive briefing. Just good luck with the other days of the vaccination. I look at Christian. He is confirming that the notes will reach you very quickly. And we have not finished with WHO. We still have 2 invitees from them. So I'll now turn to my right and then to my left for the colleagues from the Office of the High Commission for Human Rights. Lavina, good morning. You have an update on Yemen, and then maybe we'll introduce your new colleague. Lavina.